Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. So I've got to admit that I hate conflict. I'm conflict averse by nature. I'm happy to help people through their problems. I like to help people figure out what's going on. I'm also not afraid to stand up for what's right or what I believe to be right. But conflict itself is something that I don't really like. And the podcast today is something that is really good. You're going to enjoy this conflict resolution podcast with Dr. Sharma. She is a physician, an OBGYN, who has spent a whole bunch of time creating a wonderful podcast about conflict resolution. We all come across it as physicians. Think about a time with a patient, an administrator, a fellow physician, where you can tell it's going to get conflicted and you realize that the person is not going to agree with you and you need to say the right thing to defend what you believe or what you believe the right thing is for your patient or the right policy for your department or whatever it may be. Conflict is baked into the details of our lives. So learning how to manage it is very important. So I'm excited to welcome Dr. Sharma, and I know you'll enjoy this episode. Hey everyone, I am really excited that we have Dr. Sharma here with us today. She is a very interesting person, and I think you're going to really enjoy this podcast. So, Dr. Sharma, would you mind introducing yourself to the audience?
Absolutely. Hey, Peter. My name is Sharma. I'm a physician in private practice in Auburn, Alabama. I actually, in undergraduate, double majored in music performance and pre-med, and after finishing that, decided I did want to go to medical school. I went to medical school, did my residency in OBGYN at Parkland Hospital in Texas, and then moved back to Auburn in 97 with my husband. Since then, we have two wonderful children. We've both explored lots of different hobbies, and most recently gotten into the world of podcasting, where I've been able to share my experience with conflict resolution. I work as a mediator and somebody who analyzes conflict in hospitals and healthcare systems, and bring that to my podcast, Scalpel and Sword. So it's been a great journey.
Yeah, I have really enjoyed listening to your podcast. We'll get into this a little bit more later about why conflict resolution and how you got into it. But just for a minute, a majority of our listeners are physicians, but I would like to hear just a synopsis briefly. Why did you choose medicine and particularly obstetrics? Because I think it will inform a little bit about why you're still in medicine and why you do what you do.
I was really very blessed at a young age to be exposed to medicine by two people who were very passionate about doing it. My dad was a general surgeon. My mom was a pathologist, and they both loved what they did. My dad was very passionate about patient care, and at a young age, they exposed me to being in a hospital. And unlike a lot of my peers who I think were freaked out about being in medical situations, I love being in a hospital. And my parents were very open about sharing their experiences with me. My mom took me along on frozen sections. My dad took me on rounds. And I think in addition to that, they never forced me to go into medicine. They definitely left it very open-ended. If I had decided to be a professional musician, they would have been completely fine with that. I was very fortunate to perform at a pretty high level when I was at that phase in my life. And most of my friends knew I was trying to choose. And when push came to shove, I knew I was going to be happier being a doctor long-term than being a musician because it was a much more concrete way to serve. And as I got through medical school and was choosing specialties, I really had a passion for women's health. I loved my female patients. I liked my male patients, and they were fun and they were interesting. But my female patients had my heart. And I loved the idea of being in a specialty where I could do surgery and still do some primary care. I got to be with my patients through having children and maybe having gynecologic surgery. I got to be there through all of those phases of their life and support them in menopause and beyond. And it was a choice that felt very instinctive, but has paid off long-term in terms of being very rewarding as a career.
Yeah. And it's interesting to reflect. Most people, when you talk about why medicine, almost everybody has this junction where they said, I thought about being X, Y, or Z, but I felt called to medicine. And obviously you were a talented young person with musical talents and you're have to be good at academics to get into medical school. You had all these things. And yet with that, you chose medicine and you chose the difficult life that comes. Like OBGYN is notoriously difficult because I'm a family doctor in a rural area. We deliver babies at all sorts of crazy hours. They love to come at 2 a.m. I don't know why, but it's their favorite time. And so you chose that, even knowing, having parents who are physicians and really knew what that was. And so it's admirable that you chose that. And I think it's interesting that you've stayed with it for all these years. That's awesome.
And it was really very wild because my mom did at one point say, as a working mother, would you be interested in pathology? She did bring that up with me. And I did get to go with her and watch her do Frozens and stuff. And it was really cool. And I had huge admiration for her knowledge base, just a brilliant doctor. But I told her, Mom, if I did what you did, if I sat in a room all day with a microscope, I would go nuts. I love it that you love it. And I love it that you are brilliant at it, because for 7 years in private practice, she was my pathologist. And,
Oh, how
I have
cool.
I have this very great memory of when we first moved back here in 97, and I was on call. I had a patient who had a pelvic mass, needed a laparotomy, and she happened to be the pathologist on call. And this was back in the day in the operating room where they had intercoms. So it wasn't like you were on the phone. The whole OR staff heard it. And so have this mass out, send it for frozen, mom's on call, and the intercom clicks on and I hear it and I go, hey, mama. And she goes, hey, sweetie. And the whole OR just, and one of the scrubs said, bet she doesn't call the general surgeons that. It's a really wonderful memory of being around my parents, but also too, I told my mom, it's like, I could do what you do and I could have a quality of life, but I wouldn't enjoy it. So I'm trading quality of life for practicing a style of medicine that wouldn't have brought me the joy that this has.
And it's interesting also to talk to people in different specialties, because you're sort of, I try to tell my kids within medicine, there's thousands of jobs and you have to find what you're attracted to, what your aptitudes are, what you like. I have a son who is pretty interested in pathology. He might choose that. And I think he would be doing great. And I've met several pathologists who I think are probably like your mom, just passionate about what they do, amazing at it. I could not do my job without excellent pathologists, but it's not my specialty. I think I have to talk to people or it would drive me crazy. But my son, I think that if he chooses medicine, that would probably be just an exactly good choice for him. So it's just interesting how we all have this variety of different interests, and medicine can take all types. It's not just one certain type of person that can become a doctor.
And isn't it cool that you can see that in him? You can
Yeah.
see in him, it's like, I can see that this was something that had really float his boat, and you can encourage him in that direction. I love that.
Yeah. He won't like it if he listens to this, but I told him if he can memorize the entire Pokemon index, there's a book like this thick, if you're watching on the YouTube, that he memorized the entire thing and every association about everything. And for whatever reason, at this age, he's just into that stuff. I'm like, man. And I told him, if you memorize something useful, imagine the good you could do in the world. He didn't like that too much, but I'm so
Well,
thankful that he has this aptitude. He's really got this ability to make associations and categorize and see things once and understand it. It's like, man, you would make such a good pathologist.
isn't that cool? And it's so funny you said that, because my son was the same way when he was younger with Pokemon, and he still plays Pokemon on his phone. So, and he is now a chemical engineer. So yes, I can
Oh,
totally see that brain connect. So when you're talking about Pokemon, I'm like, I got one just like that.
yeah. So we'll see where he goes. And all of you listening probably have kids and you're looking at it and you're thinking like they've got to become something. It'd be interesting, and medicine is hard. Like it's a difficult career. And yet I am honored to meet so many different physicians. And I still think it's really the most unique and greatest profession that there is, because you're so much into the details of people's lives and it makes a difference in a way that no other profession does. And so we need our best and brightest to go into medicine. And I hope that a lot of people will. It's not for everybody, but of course, I hope a lot of people will still choose that as a career.
Same. And I think that's a big part of what we do, Peter, is being those mentors. And that can be for our children or for other people that are part of our family that we've adopted as mentees, that we encourage them, and not just encourage them to look at medicine as a true career and calling, but also be with them on the path. I can't tell you how many medical students that are now in private practice that have my cell phone number and they still text me and they still ask me questions, and I still like to check in with them and see how they're doing. So it's not just that you're encouraging them to consider the profession, you're wanting to stand by them as they continue it.
Yeah, that's a great point. We need to stand by people because one of the things we talk about on my podcast quite a bit is trying to leave medicine better than we found it. And I think that's one of the ways we do that is by offering mentorship to people and offering a way forward and giving practical real world advice to help people along the way. So it is a really cool opportunity. If you're in medicine, lots of opportunities to teach and mentor as well. So I appreciate that you're doing that.
Hopefully, and continuing to do that. Yes.
So I want to jump for a minute to your podcast. I think this is interesting. There's lots of podcasts you can turn your time to, but there aren't that many physicians who make podcasts. And specifically about conflict resolution. I think about conflict. I'm kind of a conflict avoidant sort of person. I would happily solve the problem without the conflict, but it's baked into our jobs. It's baked into many things that we have to do. We have to be able to manage conflict in a way where relationships are still preserved and where the best good comes from it. So I want to hear your story. How did you choose to do a podcast about conflict resolution? Because it's really a challenging area for a lot of people.
Absolutely. And I think that's part of the reason why, as a physician, I really wanted to get into this topic and really, as much as possible, share what I've learned in my experiences. I had been in private practice for about 4 years and I was really unhappy. I really didn't like where I was. I didn't like what I was doing. And at that point in my life, I thought I just didn't like practicing medicine, which terrified me because I'd spent so much of my life on that journey. And I was looking to do a fellowship in health policy, but instead what I found was a master's program in conflict resolution that was actually a distance program. And so I was doing full-time obstetrics. I had 2 small children, my husband's pulmonary critical care. And I said, I really think I want to do this. And I had the support of my parents and my family. And what it really taught me, number one, like you and like so many of us in medicine, I was a huge conflict avoider. I didn't know how to deal with it. I'd never had those kind of skills modeled for me. I saw a lot of toxicity when it came to conflict in medicine. And what doing the master's taught me, number one, it gave me very practical skills to understand conflict, but it also gave me some very practical ways to understand myself and how I approached conflict as a human being and as a physician. And understanding how I approach conflict and understanding conflict itself, it made me less afraid to be in those situations, but it also taught me something really powerful, which is conflict can be transformative. That I think my whole life, I thought conflict was an illness. I thought it was something we had to stamp out of the population. Conflict is a vital sign. It shows you that something's going on. And if you can pay attention to the fact that conflict is a vital sign, it's showing you a place that you need to step in and get more understanding. It has the potential to be creative. And once I got a few experiences of doing that, actually working with conflict in that way, you start to feel very hopeful about what conflict can achieve and you get less afraid of it. And I was on Brad Block's podcast, and this was in, I think, 23. He had asked me to be on the Physician's Guide to Doctoring, and we ended up doing a couple episodes. And he said, "You can do this. You're pretty good at it." I was like, "Oh, okay, cool, thanks." And then last year, he reached out to me and said, "Would you be interested in doing your own?" And I had been kicking around that idea, and with the help of Doctors Podcast Network and Desiree Leos and all the people that encouraged me, I launched last year. And what's been so cool about it is not just able to share these experiences and, like you said, meet so many amazing physicians and really get to share the work that they're doing. It's honestly deepened my understanding of conflict itself, and it's made me even more passionate about helping other doctors do the same.
Oh, that's wonderful. Thank you for sharing. One of the things that your statement reminded me about is you've heard that phrase, there's no growth in the comfort zone. There's no comfort in the growth zone. And when I think about conflict in my own life, whether it be in a workplace setting or some other professional setting or in a home setting or even a family setting, sometimes that conflict is really buzzing around the area where attention is needed. And it is uncomfortable for sure to say that we have to grow. But when it's managed properly and both sides or multiple sides of the conflict are given ample voice to speak and are heard, a lot of times you find that you have more in common, at least your end objective is more in common than you thought. And the things that you were conflicted about really are, like you said, a chance to grow. And you realize, oh, this is something that we could fix. And it's like that communication theory where if both people start at very far ends of the spectrum, it's hard for people to arrive at the same conclusion. But if you do it incrementally and say, well, I understand what you're saying, but here's another point you may not have considered, it really does lead to some powerful conversations. So I would like to hear some of your insights on that, because I think we can all reflect and say, okay, it's uncomfortable, but there is power and it can be transformative.
Absolutely, 100%. And I really love, because this, what you just described is something that I think is so important, is a lot of people do start on two sides. They start on opposite ends. And it's really hard sometimes when people are locked into these positions to actually bring them to the middle. And it's so much more effective to start with where we agree. Let's talk about what we agree upon. And like you said, and I think this is so true, we tend to agree on more than we realize. We don't really understand how much we have in common until we actually start there. And when we start there, the things on the edge that maybe we don't agree upon, those are things that we can work on. But all of a sudden, what happens is I trust you. I've created a space where I know where you're coming from. I know that you want the best outcome. And if I know that's where you are, I'm going to be much more likely to walk this process with you. Maybe we won't get everything resolved the first time out of the gate, and chances are we won't, but we're going to have enough of a start and we can come back and continue to work on this. And I think that's such a big deal, that as you bring people into this process of conflict resolution, whatever it looks like, because it's not going to look the same for any two people or any two doctors or any hospital and hospital system or surgery center or whatever situation you're working in. You're not going to have two absolutely identical solutions. But what you are going to have is a process that can evolve. And you can say that honestly about any situation you're working in. And if I have a process that we can buy into and that will evolve over time, it's not just the conflict that's in front of us that we've worked on and improved, it's the conflicts to come, because there will be more. And I think that sometimes we think that the absence of conflict is peace. The absence of conflict means that we just haven't talked about what's going on. And it's going to blow up at some point. It's just going to be there and be there. It's going to be like a little hum that's under the surface. We all know there's something there we haven't talked about, but we're all afraid to talk about it. And then all of a sudden something happens. And sometimes that something that happens may be a bad patient outcome. It may be a doctor that's leaving. And then all of a sudden we are confronted, oh, this has been going on all along. We haven't dealt with it. When you actually put a process in place that people believe can work, you don't have the hum. You don't have this little undercurrent that's always there. You have a space to talk about it. And that is the essence of conflict resolution.
That's awesome. I like that idea of the hum. It's there, it's unspoken, but if you don't address it at some point, it will come and get you. Here's another thought I had just thinking about this. When I've talked to people in different groups, whether it be political ideology or something at work where people see an issue differently, the far extremes of both ends of whatever argument see the issue as settled. This is settled. Of course, it should be this way. Nobody could possibly see it different. And the other side has drawn the exact opposite conclusion and says the same thing. How could anybody possibly see this different? This is a settled issue. It's already settled. There's no more room for debate. And yet we have to meet in the middle. And one of the points that I was thinking about as you said this is the relationship does matter. And like I've found that if it's just people debating on Facebook or on some social media channel, there's no relationship building. It's just like people defending their position that they consider the high ground on their position, yada, yada. But when you meet in the middle and you try to address that uncomfortable middle and say, what are the places where we do get along and what's our relationship look like? Then you really can start to exchange ideas and say, we agree on this enough, so much that we have enough relationship, enough of a friendship or mutual respect that we can talk openly about this. And we may not agree at the end of it, but at least we understand each other. I think that's so powerful.
I absolutely agree with you 100%. And it's very interesting when you do get into people who, it's called positional bargaining, that you people have locked into these two different positions. Yes. If you just try to argue the position, you will never get resolution, ever. Because people have invested more of themselves and their capital in the position. And I love how you talk about the fact when you start to prioritize the relationship. I am interested in keeping a relationship with you. And because I'm interested in keeping with the relationship with you, it's not that I'm not willing to let go of my position necessarily. I'll get there, but maybe not from the jump. But I'm willing to listen to you. I'm willing to hear what you have to say. And as I hear what you have to say, and I start to actually, I'm trying to understand. I'm being curious. The exercise of curiosity in any conflict is always a beautiful place to start. Because when people get into positions, they're not curious. I don't care what you think. I just know what I think. But when you start to be curious about what the other person thinks, that's a door opening. That is how you start to have the discussion.
So how do you recommend that? Again, you're talking to a group of physicians. We all sit on either on a medical board, or you're part of a committee, or you're part of a state medical chapter, or a variety of things, or just even interacting with our patients. How do you recommend starting that? Because that's what we know needs to happen. Instead of this positional debate, you want the curiosity, and to sometimes to initiate that. People have put up these walls and we can't even talk to those other people because we don't want to give them space, or I don't want to give them airtime, or I don't even want to respect the fact that they exist. Like there's some real challenging walls that people build up, which are crazy, but that's what happens. So what do you tell a group of people who says we are at loggerheads, we're at opposite ends of this and nobody will talk? And how do you engage in that process of curiosity from your experience?
So this to me is probably a really great way to start. And is one of the things I encourage people to do. Actually, when I did my first trainings in labor and deliveries, this was something that I taught the nurses to do if they felt like they were really having a challenging time working with a particular patient or physician. And it's something that you do very beautifully on this podcast, which is I will ask Sam, tell me your story. And I think the first time I heard a nurse say that she used it successfully was a patient who was, I think she was refusing induction, or she was refusing something to augment her labor. She's, I'm not doing it. I'm just going to sit here. The baby comes. And she didn't know what to do. She didn't want to force her into the situation. And so she remembered our training and she said, tell me your story. That's all she did. And then the patient launched into the fact that she had a family member who had died in labor. And in that patient's mind, the reason why the family member had died was because of the labor augmentation. And so as the nurse heard the story, it gave her a chance to understand where the patient was coming from. It's like, okay, let's talk about the story. Let's talk about what may have happened. I wasn't there, but let's talk about why you may be different and how we can approach this process in a way that's going to be working for you. And all of a sudden, the patient felt heard. So when you ask somebody to tell your story, tell me your story, it's very hard for us to get defensive when we're telling our story. If you ask me, well, why do you feel that way? Immediately, I'm going to put the walls up. I don't want to explain to you why I feel a certain way. I just do. But if you asking me, just tell me your story. I'm not asking for a defense. I'm not asking for an explanation. I just want to hear your story. It is really cool to see how quickly everything drops. People just don't get defensive when they tell stories. And as physicians, part of the reasons why sometimes we don't do that with our colleague, like you said, is we get very locked into a position. I'm too busy defending my position. I don't have time to hear your story. So it does take that extra second of just stopping and taking a deep breath and saying, I really know that where I am right now is not productive. I don't feel productive. I feel angry. I feel like I'm defending my ego and I don't like how that feels right now. And so if you can actually, and it takes practice, if you feel yourself in that situation, and we've all felt it, right? Where you've been in the room with a colleague, or you've been in the room with an administrator, or a room with a patient, and you feel like your chest tightens and your breath starts to change. And we sometimes pick up on that from that standpoint more than consciously we recognize we're in a conflict. We feel it first before we're actually in it mentally. But if we can feel ourselves going into that, it's like, okay, so I need to take a breath. And instead of launching into, well, I think you should do this, going, tell me what's on your mind right now. Tell me your story. And all of a sudden, that conversation shifts. And that shift is the opening for being able to address the conflict.
Yeah. And like I said at the beginning, as a person who's a little bit conflict averse, I can tell when I'm heading there. My heart rate goes up and you're like, oh dear, I can tell this is conflict and I want to just defend. And I can think of probably lots of negative examples where I haven't handled it correctly. And I think we probably all can. But when we do it the way you just said, where you see the other person as a human being and that a relationship worth investing in, I do think we get more mileage out of it. And I think as busy physicians, sometimes my default is I am too busy for this. I don't have time for it. I've got to get back to clinic or notes, or I've got 3 phone calls, or I've got someone in labor right now. I don't have time to deal with this person's ridiculousness. And so I know the temptation is to be like, I'll just bulldoze through this and I'm the doctor, I'm going to get my way. But you might win the battle, but you don't win the war. And so it is very important to say, I actually spend less time on this if I schedule time to talk about it and hear somebody's story, because then you actually get to the root of what's going on. You have a relationship, and then you can begin to say, okay, because of that relationship, we can disagree and we still have a relationship, and you know where I'm coming from and I know where you're coming from, and we can disagree, but we can still talk to each other at the end.
And like you said, you preserved the relationship, that you actually have an opportunity to continue the dialogue rather than maybe choosing the default of I'm the doctor and I say so, which we've all been in those situations and we've all had times that we've done those things and we look back on that and go, oh man, I really messed that up. And I always say it's like the time, one of the things I think is beneficial about having had the training and being able to do this in real time is that when I have done those things, I usually will call the patient back or say, okay, I totally messed that up and I'm really sorry. And I'm not making excuses for myself. I really want to have this dialogue with you. And I have never, not once in my life, had that happen where I've called a patient back and said, I did not act nice to you today and I'm sorry, where the patient did not respond favorably. And I think that's the first thing. So the times that I do mess up, I feel like because I am less afraid of being in that conflict situation just because I've practiced it now, I don't mind going back and saying, hey, I'm sorry for the way I acted. But there's something else that you said that I just want to briefly touch on, which is this idea that we don't always feel like we have time to address these kind of things, like having this conversation of saying, tell me your story or you tell me where your head is right now. We feel like we don't have time to do that. When we talk about the times that we've messed up, and like you said, we've all had them and had these negative or not productive interactions with anybody, patient, staff, it's the mental cost that comes after. Because I guarantee you, when you've had those interactions, because I've done it too, I think about it on and on. I'll think about it throughout the rest of the day. I'll still be seeing patients, but I'm still thinking about that interaction. Man, I didn't like how I acted that time.
And at 4 a.m. the next morning.
Absolutely. And so the mental energy you've expended. So we feel like we don't have time to take this 1 minute to have this person tell me a story, but then we're going to spend the next 24 hours going over it and over it again in our heads. So what would you rather do? Would you rather spend 2 minutes getting to the absolute root of what's going on? Or do you want to invest the next 24 hours of mental energy just going over this over and over again? I'll take the 2 minutes.
Absolutely. So another aspect of this, so you said something really important. When you recognize you've done something that was insensitive or too much one way, or you were in too big a hurry, you take the time to call the patient or the colleague or whoever and say, hey, I realize I didn't handle that well. I want you to know that I apologize for handling that. I'll handle it different next time. But sometimes as physicians, the training is document the heck out of it, make sure that it's going to stand up to a legal lawsuit. I was right. And you know what I have found? Probably the same thing you have, and probably most physicians have found. Patients don't sue you unless they're mad. And so even though taking the time to call someone and said, I handled that poorly, please please give me another chance to do a better job in my communication with you, even if what I'm saying is still correct and you might be wrong, but I handled this poorly. I do think that may actually reduce your liability from a lawsuit standpoint, because now the person realizes, oh, this person heard me. I wanted to hear your experience on that or your perspective on that.
I 100% agree with you. And what's so interesting, Peter, is that we're never taught to do that. That was not something that we were ever taught to do in our medical education. We were taught to document. We were taught to, if you did something wrong, you don't say anything about it. And because we've never had that training, many of us have now having to learn it ourselves. And I think that was definitely my case. I was not taught to do those things. It was something I definitely learned through doing the work that I've done. But I think it's so true. If you look at the data, patients don't sue because of bad outcomes. There's lots of bad outcomes. Patients sue because they feel like their doctor didn't care. And so when they have that experience of thinking, oh, this person didn't come and talk to me, I never heard from them after the bad outcome, or I had this negative interaction and I never heard anything else about it, the patient may be thinking, this person doesn't care. It's hard. It is hard to pick up a phone and call somebody or purposely make time to go see somebody in the hospital that you know had a negative outcome or had something happen. You didn't do anything wrong, but outcomes happen. But the fact that you actually went in there and held the patient's hand, or I'm really sorry this happened to you. It is okay to say those things because you are communicating to the patient that you actually are concerned with this relationship. And as a result, the patient feels respected, they do feel heard, and they are absolutely much less likely to do anything like legal action.
That is interesting. And I can think of the times when I've called patients or called colleagues or sent an email or whatever it may be after the fact, after I've digested it. I feel like those are moments of Peter's greatest courage. I just
Yes.
think, all right, I have got to be so brave to call this person because it's nerve-wracking. What's the person going to think? Are they going to yell at me? Are they going to be mad at me? And maybe sometimes they'll be like a little bit, they want to get it out. But after they realize I'm actually calling to listen and hear, every one of those actions has resulted in a positive outcome, even though it's really hard. And it would be easier on that day not to do that. But in the long term, it is better, whether it be a colleague or a patient or whoever, to say, hey, I'm mortal, I'm human just like you. My interactions with you messed up. Or when somebody has a bad outcome, because again, we're mortals, we break, say, boy, that's rough that happened. How are you doing? I'm so sorry that you have this bad outcome, without necessarily saying I did something bad and that therefore you have this
Right.
outcome, but say, I'm sorry for your loss. I'm sorry for the challenging situation you're in now. I do think there's power in that. That communication is so key and so vital to what we do.
Absolutely. And you mentioned it, and I think this is such an important part of what you said, that you are making the space for the patient or the colleague to communicate with you. You are creating that space for them. And as you're creating that space for them, they feel heard. And when patients feel heard, when colleagues feel heard, you don't know what's going on in that colleague's day. We have no idea sometimes what's going on with people, but you've created a space where they feel like you care for them. And there's only good that can come from that.
Yeah, it's hard to believe, but even administrators, I've found that's helpful. Sometimes people put them in a box and think, oh, these people don't know what they're doing, but they put their shoes on one foot at a time, just like everybody else, and they're dealing with pressures and stress. And it doesn't mean you have to agree, but there's you catch a lot more flies with honey than vinegar. It is helpful to say, like, help me understand. And then when you do something, say something rude or thoughtless, go back and say, hey, I handled that poorly and I apologize and I want to move forward. So anyway, thank you so much for sharing that. It takes a lot of courage for all of us to try to communicate in that way.
Yeah.
So as we come to the last segment on this, I wanted to ask you a little bit about your experience as a podcaster. People listening say, oh, I've got a lot to say about this and that and the other. Maybe I should become a podcaster. And then you look at the practical part of it and you say, it takes time. It takes money to have the setup and to edit all my ums and ahs and all that stuff out. How do you possibly do it? And how could you make this something that fits into your schedule, fits your mission and your drive, but also makes it so that it's financially viable? Because not everybody should become a podcaster or even do anything on social media, but it really is helpful to have more physicians' voices represented in this space.
Absolutely. I think for me, first and foremost, when I really started thinking about podcasting, one of the things that I think Brad really encouraged me is that in this space, I have something I can contribute, that I have experience that's unique in the world of medicine. There are not a lot of doctors who are doing conflict who are also practicing physicians. I'm meeting more now, which is actually really cool. Through the podcast, I've actually met doctors that are doing this work, which makes me so happy. But understanding, just like you were talking about, when I realized that learning this subject matter was going to actually not only make me hopefully a better physician, but definitely a happier human, I want to share that. And so podcasting becomes a platform with which I hope I can share that with other people, and hopefully they can have some of the benefits that I've had. And I think that's the first thing. I think in terms of logistics, I had to learn a lot about how to set up microphones, how to set up all of the equipment. And I have a lot of help. Doctors Podcast Network was so helpful. And Desiree especially has been really helpful, me getting my setup and my microphone and my lighting and giving me that feedback. I think that's been really beneficial for me. I think the biggest thing for me in terms of just the work that goes into podcasting is really twofold. And the first one is really seeking out subject matter that I think is going to be beneficial for listeners. I think one of the things I love about doing podcast swaps is because it really helps me bring other people's voices out and vice versa. But also, I have been very blessed to find so many people who are generous with their time. I have cold emailed so many people that I read their article in JAMA, or I saw them on this particular platform and I really love what they had to say. And I've shot them a message and said, hey, I do a podcast. Would you like to be a guest? And people are so generous with their time and their energy and their expertise and intellect. And that has been one of the coolest aspects of podcasting, is that you meet people who are willing to spend the time and energy to do this with you. And that has been cool. I think from a financial standpoint, one of the things it's done for me, because I do other things apart from my clinical practice, I do consulting for hospital systems. I do educational programs for residencies and for medical practices. I write curricula and try to do thought leadership for a lot of regional health systems. And so what the podcast also does is it helps me get that work in front of people that I will eventually be consulting for. So the podcast becomes not only an opportunity for me to get this wonderful voice of all these people doing great work with regards to conflict and health policy and all the things going on in medicine that I think play into the conflict we face daily. But it also gives me an opportunity to kind of get my work out there. And it's really been cool how that work has expanded and almost blown up over the last year of being a podcaster.
It's one of the last remaining long format, I think, media channels. There's lots of things where people getting shorts and YouTube snippets and TikTok hits. And then there's some longer format programs on television that people still tune into. But most segments are really short. And podcasting is really fun in that regard. You get to actually know the expert, someone that's writing an article or generating that content. You realize, oh, this person is really interesting. And they came to this very honestly. And so I've enjoyed the same. And I think what you said about getting your voice out there and content out there, it is a really powerful way to do that. So if you're a physician, you're listening, you're saying, hey, I want to join a podcast, contact me, contact Lee. Let's,
Yes.
come be a guest, try it out, see what you think. But it is a really wonderful way for physicians to get their voice out. And when you do call people, I found that as physicians, especially, really consider themselves part of this brotherhood or sisterhood of docs. And there's only so many of us. And so when a fellow physician calls and says, hey, do you want to be on my podcast? Almost everybody responds positively. It is an amazing thing. So I appreciate you sharing both the nuts and bolts of the logistics as well as your motivation to be a podcaster. It's amazing.
It's been a great journey. I've really been thankful to be able to do the work, but also meet the people and be able to hopefully help them have maybe a little better day, and maybe the conflicts they come in contact with, maybe they'll be less afraid to engage and encourage people to tell stories and build relationships.
Absolutely. Tell people as we wrap up here, how can they find your podcast or website or social media handle? How do people follow your work if they want to stay in touch?
Thank you for that. So my website, rleesharma.com. You can find the podcast. The podcast is Scalpel and Sword. It's on all the major podcast platforms. I'm pretty active on LinkedIn. So if you want to reach out to me on LinkedIn, we'll put those in the show notes as well. Desiree has all my stuff, but we'll put all that in there as well. And I really love to have people reach out. scalpelandsword@gmail.com is the email. I love people to reach out. A lot of people have reached out to be guests on the podcast, and I have absolutely loved that. So I always really appreciate when people reach out and make contact.
Well, thanks again. Dr. Lee Sharma, thank you for taking the time to do this. I hope you keep in touch. Thank you so much. Have a wonderful day.
Thank you, Peter. This has been fantastic.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.